Hi, my name is Ashley Drengler, and I'm a Vanderbilt medical student. Today, I will be talking about my project, the Federal Nutrition Assistance Programs and Ultra-Processed Food Intake among Low-Income Latino Preschoolers. So for a little bit of background, the United States government sponsors two major food safety net programs, the Supplemental Nutrition Assistance Program, known as SNAP, and the Supplemental Nutrition Program for Women, Infant, and Children, also known as WIC. Roughly 1 in 8 people in the United States receive federal food assistance in the form of SNAP and WIC. In 2020, this roughly translated to 40 million Americans on SNAP benefits and 6 million on WIC benefits. The aim of these programs is to provide nutritional security, which is defined as readily accessible and nutritious food to people in low-income households. However, children participating in SNAP and WIC programs often have lower quality diet compared to income-eligible non-participants. I'd also want to talk a little bit about what ultra-processed foods are. These are industrial formulations that are commonly consumed by children in the US. The NOVA classification classifies foods on a spectrum of amount of processing. And ultra-processed foods is the fourth group in this classification, and it includes foods such as prepackaged meals or fast foods. Ultra-processed food consumption has been associated with multiple chronic diseases, including obesity, cardiovascular disease, hypertension, cancer, and cerebrovascular disease. Among US children aged 2 to 19, ultra-processed food consumption has increased from 61 to 67% from 1999 to 2018. Furthermore, children from low socioeconomic households and of racial and ethnic minority groups often have disproportionately higher rates of ultra-processed food consumption. So the purpose of my project was to evaluate the association between participation in federal nutrition assistance programs, SNAP and WIC, and the percent of daily calories consumed from ultra-processed foods among Latino children aged 3 to 5 from the Nashville area. My project was a secondary cohort analysis of a randomized controlled trial for childhood obesity prevention. This trial was called Growing Right Onto Wellness, and 610 Latino parent-child pairs from underserved neighborhoods in the Nashville area were enrolled. The eligibility criteria was that the child had to be aged 3 to 5 at enrollment, and they had to live in Nashville, and they had to qualify for at least one service for underserved populations. And examples of these included Medicaid, TennCare, and free and reduced lunch, and SNAP and WIC. The primary exposure for my project was baseline participation in SNAP only, WIC only, both or neither. And the primary outcome that we looked at was the percent of child daily caloric intake from ultra-processed foods, which was based on 24-hour diet recalls that were collected at baseline, 1, 2, and 3-year follow-ups. My primary analysis model was a linear mixed effects model that assessed the relationship between baseline assistance program and ultra-processed food intake over time, and we adjusted for socio-demographic covariates. We also performed a secondary analysis where we looked at the interaction term with food security, because we hypothesized that federal nutrition program participation may have a larger impact on nutritional quality in children with food insecurity. And then some of the covariates that we adjusted for included household income, race and ethnicity, age, child sex, child baseline BMI, and food security. So looking into our results, the first thing that we looked at was the demographics of our study population. Some things that I want to point out is that in our cohort, we had 91.4% identified as Hispanic. And I also would like to point out that 42.8% of our group identified as being food insecure. And then in terms of our primary exposure, 13% of our group was enrolled in neither SNAP nor WIC. 21% was in SNAP only, 12% was in WIC only, and 54% used both SNAP and WIC. So for our results, we also looked at the distribution of daily ultra-processed food intake at each time point by baseline SNAP and or WIC participation. We found that the median calories of ultra-processed foods consumed at baseline was 690 calories raw kcals per day. This roughly translates to 62.5% of the child's daily diet. We also saw that the observed medium distributions were not pointedly different across the categories, but we did see that WIC only was consistently less than the other groups across the time points. Moving on to our primary analysis model, we did find that the association between participation in SNAP and or WIC and ultra-processed food consumption across all time points was not statistically significant. When we included the interaction term for food security, we again found that there was no statistically significant difference between baseline participation in a federal nutrition assistance program. So in conclusion, among predominantly Latino children from low socioeconomic status families, the percent of ultra-processed food daily ultra-processed food consumption was not statistically higher or lower among SNAP and or WIC participants, regardless of their food security or insecurity status. However, I think it's really important to point out that in these low socioeconomic status families, the percent of daily caloric intake from ultra-processed foods was extremely high, being greater than 60%. There was some evidence that participation in WIC was associated with lower ultra-processed food intake, especially for children with some food insecurity. So I think it is important to investigate the differences between these federal nutrition assistance programs in order to better elucidate ways that we can decrease the consumption of ultra-processed foods in young children. Reducing the amount of ultra-processed food consumption is one possible avenue for federal nutrition assistance programs to ameliorate early childhood health disparities that are attributable to poor nutrition quality, because, as I mentioned earlier, ultra-processed food consumption is associated with multiple chronic diseases. In terms of the strengths and limitations of my study, one of the strengths was that this was an extremely large sample size of around 610 families. With a very long-term follow-up of 36 months. And we included a wide range of covariates that we were able to assess at baseline. Some of the limitations of our study include some selection bias. Furthermore, the 24-hour diet recall is subject to some recall and social desirability bias. Furthermore, our SNAP and WIC participation data that we collected was self-reported participation. Overall, I think this study is important because while we mainly focus on Latino families living in the Nashville area, it is important to remember that there is a disproportionate burden of childhood obesity in these communities. And so this study kind of highlights how one of the things we can do in the future is develop an intervention to increase whole food consumption among families that are enrolled in SNAP and WIC. Because if you increase whole food consumption or healthier food options, as a result, you are likely to decrease ultra-processed food consumption. Thank you so much for your time and for listening.